Welcome to Cannabis in the Workplace, Use and Norms Among Canadian Employees. Thank you for joining us today. This webinar is part of our Harnessing Talent Alliance series. Harnessing Talent Alliance for Recruiting and Retaining Canadians with Disabilities is a 3-year project funded by Employment and Social Development Canada. We would like to thank our 9 founding partner organizations as well as our academic team. If you would like to learn more, please visit our website at harnessingtalentalliance.ca and follow us through our Harnessing Talent social media channels. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow it with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. We're extremely happy to welcome Dr. Nancy Carnide with us today. Dr. Nancy Carnide has a PhD in epidemiology from the Dalla Lana School of Public Health at the University of Toronto. She's a previous recipient of CIHR Vanier Canada Graduate Scholarship and CIHR Strategic Training Fellowship in Work Disability Prevention. CIHR stands for Canadian Institute of Health Research. Dr. Carnide's research interests lie at the intersection between occupational health and safety and substance use, as well as the mental health of working populations. Her emerging program of research includes examining the use and non-medical use of prescription and recreational drugs among workers, their risk factors, and the workplace consequences of their use. Dr. Carnide's most recent research focuses on the impact of cannabis legalization on the Canadian working population. She's co-leading 2 studies related to workplace cannabis use and related perceptions and knowledge among Canadian workers, as well as cannabis involvement in workplace fatalities in Ontario. Nancy, thank you very much for accepting to talk to us today about the use and norms of cannabis in the workplace in Canada. I will let you take over without further wait.
Okay, great. Thank you, Yusra. I'm just navigating here. Okay, so thank you to everyone who has joined today, particularly given the circumstances. I hope everyone is home and staying healthy and safe. And I'm doing my part, and I'm also working from home and doing this presentation from home right now. So there is a small chance, or perhaps a big chance, you may hear my child in the background. I've asked him not to come into the room, but just bear with me if there are any interruptions. So as Yusra mentioned, today I'm going to be talking about cannabis legalization in the context of work and the working population here in Canada, and some of the research that we've been conducting at the Institute for Work and Health on this topic. So before I continue, I just want to acknowledge members of the research team that have been involved in this work. Most of them are from the Institute for Work and Health, including the co-lead of this project, Dr. Peter Smith. I'd also like to acknowledge the Canadian Institutes of Health Research for providing funding to conduct our research. And I'd also like to acknowledge our Stakeholder Advisory Committee who have been instrumental in providing guidance on the research that we are conducting in this space. This includes representatives from a number of occupational health and safety associations, employer and labor representatives, workers' compensation, and a number of government departments and agencies, including those in health, substance use, and labor. So as I'm sure everyone knows, October 17th, 2018 marked the first day in which cannabis for non-medical purposes was officially legalized in Canada. And that day came with a lot of fanfare, a lot of hype, but also some trepidation. We're certainly not the only ones to be undergoing changing cannabis legislation and policy. So several jurisdictions around the world have either legalized or decriminalized cannabis use or are considering doing so. Most, however, have focused on medical cannabis. And of course, we've had a medical cannabis program for almost 2 decades. What sets us apart is that we are only the second country in the world to legalize cannabis for non-medical purposes at a federal level. So with that, we are heading into some uncharted territory, and we don't necessarily know what the impacts will ultimately be. There is some research coming out of the US states that have legalized cannabis for non-medical purposes before us that we can look to understand what their experiences have been with legalization. But there are 2 key differences that can make this a less than ideal comparator. So one, while certain states have legalized cannabis for non-medical purposes, cannabis use is still illegal at a federal level in the US, which is the opposite of what we have here. And 2, the frameworks that have been used to establish a legal market in several US states have been often modeled after alcohol policy, which do not necessarily consider the public health implications, but focus often on profit. So on the other hand, Canada has approached legalization with the goal of protecting public health and safety, and that's always been at the forefront of this legislative change. So as we move forward, it will be important for us to understand how our current policies around cannabis are affecting public health and potentially certain vulnerable subgroups of the population. So in all of these discussions around cannabis legalization, workers are not necessarily top of mind as an important subgroup to consider. However, for a number of reasons, I think it's important to keep workers in mind. For one, workers represent a large proportion of our population, roughly 62%, and spend most waking hours either working or commuting to and from work. The length of working life is also increasing. And so with all of this, there is potential for cannabis use to spill over to the workplace. And if it does, we need to consider the potential effects of cannabis use and impairment on safety. So depending on the type of cannabis and the amount consumed, a number of different impairing effects can result. And these include adverse effects on memory, on attention and concentration. It can result in slower reaction times, impaired coordination, as well as altered space and time perception. These effects are particularly problematic in the context of a safety-sensitive job, which is defined as a job that, if not performed in a safe manner, can cause direct and significant damage to property and/or injury to the employee themselves or others around them. So some examples of safety-sensitive tasks could include the ones that we would traditionally consider hazardous, things like operating motor vehicles or heavy equipment, working at heights, but they may also include caring for vulnerable populations or completing tasks that involve high levels of judgment. An example here might be a physician. So we need to consider how cannabis use in close proximity to certain safety-sensitive tasks may be particularly risky. So in terms of what we know about what has been happening since legalization, Statistics Canada recently put out a report describing some early findings on use of cannabis from before and after legalization. And what they found was that the use of cannabis overall among adults has increased, so that before legalization in 2018, approximately 15% of Canadians reported using cannabis in the previous 3 months. And that increased to about 17% in 2019 after legalization. So that's equivalent to 4.5 million Canadians in 2018 and increasing to 5.1 million Canadians in 2019. And this was seen, as you can see, across age groups. This was seen across all working aged groups, but particularly among the 25 to 44-year-olds. And in fact, this is very consistent with what we were already seeing in terms of the trend of prevalence of cannabis use in the lead up to legalization. So this graph shows us the prevalence of cannabis use among Canadians from 2004 to 2015. Not surprisingly, youth and young adults consistently demonstrated a higher prevalence of use. Those are the orange and blue lines at the top of the graph. But what you will notice is that the prevalence has been fairly constant for these two groups. On the other hand, when you look at 25 to 44-year-olds, which is the gray line, and 45 to 64-year-olds, which is the yellow line, you will see that in recent years, there has been a significant increase in the proportion of Canadians in these two age groups who report using cannabis. So this isn't just a youth issue. We also need to think about use among working-aged Canadians. So the question is, what has been happening among workers specifically? Have overall cannabis use patterns among workers changed since legalization? Are more workers using cannabis before or at work? Are workers thinking differently about cannabis use at work than before legalization? And what might have changed in their workplaces? So these are questions that we set out to answer with our Toking 9 to 5 study. The goal of this study is to evaluate the impact of legalization on cannabis use and knowledge and perceptions about workplace cannabis use among Canadian workers. So I'm just going to briefly touch upon some of the methods. So this is a longitudinal survey study that we are conducting from 2018 through 2021. Workers from across Canada and from a variety of occupations and industries are eligible to participate, provided that they work at least 15 hours per week in workplaces with 5 or more employees. We are also surveying not only workers who use cannabis, but also those who do not. Recruitment of our sample is being conducted by Ecos Research Associates, which is a private survey company. And the sample is primarily obtained from a pre-existing panel of about 100,000 households who have agreed to participate in surveys from time to time. In addition, a very small proportion of the sample is recruited using traditional random digit dialing. So this study consists of conducting 4 yearly surveys with workers. The first survey was conducted in June 2018 with 2,014 workers. That was about 4 months before legalization. The second survey was conducted from July to September 2019, which was approximately 9 to 11 months after legalization. In that second survey, we reached out to participants of the first survey to request their participation again, and 1,099 workers from the first survey also completed the second survey. We also recruited an additional sample of workers so that in total, 4,101 workers participated in Survey 2. The next 2 surveys in this study will be happening in the summers of 2020 and 2021. For today's presentation, I'm going to be presenting on the comparison between Survey 1 responses, which were before legalization, and Survey 2 responses, which were just after legalization. In terms of the survey content, we asked a number of questions that our team and our Stakeholder Advisory Committee felt were important to ask in the context of workplace cannabis use. I'm just going to briefly describe some of the content areas, but for today's presentation, I'm only going to be able to touch upon a few of these items. Also to note that anything denoted here with an asterisk is a new item that was added to Survey 2. So at the top there in blue, for all respondents, a number of questions related to workplace cannabis use were asked, including knowledge of cannabis effects, what the culture of cannabis use at work is, in terms of workplace norms and physical availability of cannabis, workers' perceptions about the risks of workplace use, what they think is allowed at work as a result of legalization, and a few questions about workplace policies and practices. We also asked some questions about worker characteristics, including job characteristics, health and lifestyle, and sociodemographics. And of course, we asked workers also whether they have used cannabis in their lifetime and in the past year. Among workers who reported using cannabis in the past year, we asked them a series of questions to better understand their use patterns. This included questions about how frequently they used cannabis, how they used it, the type of product they used, and why they were using cannabis. We also asked about use in the 2 hours before work, as well as use while working, on breaks, and at the workplace at the end of a work shift. So now I'm first going to present some of the findings comparing pre and post legalization overall cannabis use patterns. So this is about overall use, not necessarily use before or at work. But before I do that, I want to get a sense from the audience on what they think has happened in terms of the prevalence of overall cannabis use. So the question I have is, since legalization, do you think the percentage of workers using cannabis overall has increased, decreased, or remained the same? So I'll just give you a few minutes, or a few seconds, I should say, 30 seconds to respond. Okay, so based on the results, it looks like 52% of audience members believe that it has increased since legalization. 48% feel that it has remained the same, and no one thinks it's decreased. Okay, so what did we actually find in our sample? Okay, so the blue in this graph, and in all subsequent graphs, really represents the pre-legalization data from 2018. The orange is the post-legalization data from 2019. In general, what we found here is that the proportion of workers in our sample never using cannabis remained about the same from pre to post legalization. However, the proportion of workers reporting former use, so use more than 12 months ago, decreased, while at the same time, the proportion of workers using cannabis in the past year increased. So those who said that they thought it had increased overall were correct. So more workers used cannabis in the recent year. And what this suggests is that potentially these were workers who had already potentially tried it before. One thing here to keep in mind, and I just want to sort of caution, is that the numbers that I'm presenting here we shouldn't be using these numbers to infer that 38% of all Canadian workers in the population are using cannabis. This is a higher prevalence than what we would have expected based on population-based surveys conducted by Statistics Canada. And I think it's likely because workers who use cannabis are also more likely to participate in our survey because they know what the topic is and they're probably more interested in the topic. So I think the most that we can infer from this is that there is a trend towards an increase in use. And that is very consistent with what we saw in StatsCan data among working age Canadians. There is an increase overall in use. Having said that, I do think it's also important to note that there's no reason to believe that the workers in our sample using cannabis are any different than what we would expect. So they exhibit a similar frequency of use. Their main method of consumption is what we would expect, which is smoking. I won't be presenting that today. And also not presented in looking at the age and sex demographics of users, it's also what we would anticipate. So while we can't say this overall use prevalence is what it is in the Canadian population, when I present the remainder of the findings among cannabis users, I think we can feel pretty good about that sample. So in looking at the frequency of use, which I mentioned, we see that while more workers are we know that more workers are using cannabis based on the previous slide, but what we're not seeing is an increase in those reporting more frequent use. And in fact, what we are seeing is an increase in workers reporting less than 1 day per month use, which potentially suggests that workers, while there may be more workers using cannabis, they may just be trying it and aren't necessarily making it a habit. We asked workers why they were using cannabis. We asked this in a couple of different ways. So this slide was where we asked whether they had used cannabis, whether they were using cannabis for non-medical purposes, for medical purposes, or a mix of both non-medical and medical purposes. And what we found is that both pre and post legalization, most workers used cannabis for non-medical purposes. But we also see that a considerable proportion of workers in our sample reported using cannabis for a mix of purposes, both medical and non-medical. The changes, in terms of changes between pre and post legalization, those were not statistically significant. So generally speaking, we are seeing consistency in why workers are using cannabis. But one thing to note is that we also asked whether workers who reported some form of medical use, whether exclusively medical or a mix, whether they had a medical authorization for this use. Before legalization, we found that 41% had a medical authorization, and that dropped to 27% after legalization. And I think that really has to do with the fact that we have more workers trying cannabis out. They may be doing so for aches and pains, as an example, but they won't necessarily be seeking out an authorization just yet if they're just sort of trying it. We also asked workers their specific reasons for using cannabis. Here I'm only presenting the findings from Survey 2, the post-legalization, because we made some changes to this question on Survey 2, so it was a bit difficult to make the comparison, but generally speaking, on similar items, we saw similarities from pre to post legalization. What I do want you to take away from this slide is that workers using cannabis are doing so for a variety of reasons. Of course, there are many non-therapeutic reasons for use. Some of the main ones including relaxation, for fun, to feel good. But there's also a number of therapeutic reasons that workers use cannabis for. Particularly, they're reporting using it for sleep, for pain, to cope with stress, and for anxiety. So in the second survey, the post-legalization survey only, we added a question where we asked workers about whether they were using cannabis to treat a work-related injury or illness. And what you'll see here on this slide is that 16% of workers reporting past year use reported also using cannabis for a work-related condition. So again, I think that speaks to the fact that workers are using cannabis for a variety of not only non-therapeutic reasons, but also therapeutic reasons. So now I'm going to turn to the comparison of results that are specific to workplace cannabis use patterns. So when I say workplace cannabis use, I'm talking about use in the 2 hours before work, while working, on breaks, or at work at the end of the work shift. And again, I want to know what the audience thinks. So since legalization, do you think that the percentage of workers using cannabis before and or at work has increased, decreased, or remained the same? Okay, so similar to overall cannabis use, it looks like we're fairly split. So 50% think that it has increased since legalization, 46% feel that it has remained the same, and 4% actually think it has decreased. Okay, so what did we actually find? So we looked at this in a couple of different ways. So here we looked at this among workers reporting past year use. So it's only among the people who have used cannabis in the past year. And what we found initially sort of surprised us. Well, this isn't statistically significant. What we see is that the proportion of workers reporting past year workplace use has declined from 26% before legalization to 21% after legalization, which is, of course, contrary to the concerns that people had leading up to legalization. But in thinking this through, we think that this is likely an artifact of the underlying sample. So we have more workers they're using cannabis overall, but they appear to be doing so just to try it. And so it's unlikely that these workers are suddenly trying it at work. So our denominator essentially has increased, and that sort of has changed sort of those percentages. So what we did instead is we also looked at this among the overall sample. So regardless of whether they reported overall cannabis use, among all respondents, what is the prevalence of people using cannabis before or at work? So when we look among all respondents, what we find is that there was no significant difference or substantive difference in the proportion of workers in our sample reporting cannabis use before and or at work. So before legalization, 7% of our overall sample reported using cannabis before or at work, compared to 8% after legalization. So there really hasn't been a change, at least in our sample. We also looked at this in each time point. So in this slide, what you will see on the left-hand side, you will see the question around whether they've used cannabis 2 hours before work. And on the right-hand side, whether they've used cannabis on breaks at work. And again, you'll see from pre to post legalization, there is no difference. Likewise, this is the other two scenarios. So we see no difference in use, in the prevalence of use while working, excluding breaks, which is on the left-hand side, or use at the workplace at the end of a work shift, which is on the right-hand side. We also looked at workplace use by industry, and certainly there is variation across industries in terms of the prevalence of workplace use. However, we see no statistically significant differences from pre to post legalization in the prevalence of workers reporting workplace use. You will see that there's a bit of a blip there in manufacturing, transport, and warehousing, but so far this was not statistically significant. And finally, we also looked at this according to workplace size. And again, there were no statistically significant differences in the prevalence of workplace use from pre to post legalization. We added a couple of other questions to the second post legalization survey around workplace use. One was around whether workers had used cannabis within 2 hours of driving to or from work in the past year at least once. And we found that 11% said that they had done so, which I think will be important to monitor over time now that we have collected that first piece of data. We also asked about whether the workers had bought or received cannabis at work in the past year from their coworkers. And we found that 7% of workers reported doing this at least once. So not very common, but again, something to monitor. So now I'm going to turn to some more general questions that we asked about workplace use of all respondents in terms of workplace norms and policies and practices around workplace cannabis use. So in this first slide, we wanted to understand, we wanted to get some sense of how physically available cannabis was at the workplace. So we asked workers how easy or difficult it would be to bring cannabis into work. That's on the left-hand side. And what you see is that there's a slight trend towards workers saying that it's easy to do. It's easy to bring it into work. But you can also see that more people are also, more people or fewer people are saying don't know. And so I think what this could suggest is that people are just maybe a bit more aware of the situation, and they're a bit more sure about how to respond to this question. Likewise, on the right, we see that more workers say it's more difficult to get, buy, or sell cannabis at work now after legalization. But again, we also see fewer workers answering "don't know" to this question. So again, it could be that they're just more aware of the issue and more confident in answering these questions. We also asked about how easy or difficult it would be to use cannabis, either on breaks, which is on the left-hand side, or while working on the right-hand side. And we don't really see any substantive difference from pre to post legalization, which I think is a fairly reassuring finding. We also want to understand how often respondents thought coworkers use cannabis before or at work. That's what we refer to as descriptive norms. And we know that peer-related norms can potentially influence our own use patterns. So this is why we're collecting this information. So we asked workers how often they thought their coworkers used cannabis in 3 different scenarios, the first 2 of which are on this slide. So use within 2 hours before work, and use at work, either while working or on breaks. And what we generally see here is that there is a trend toward more workers reporting their coworkers are using cannabis in these time periods after legalization with some sort of frequency. But again, keep in mind, we also see a decline in respondents reporting "don't know" as their answer. So again, this could reflect increased awareness of this issue, but will be important to monitor over time. And this was the third scenario. We see a similar pattern here when we asked about whether coworkers used cannabis before a safety-sensitive work task. So now I want to turn to workplace policies and practices. But first, I actually just want to get a sense from the audience, not their perception about what's changed since legalization, but about policies in their own workplace today. So does your own workplace currently have a formal policy in place on substance use? And I'll just give you a few seconds to respond. Okay, so pretty good. So 70% of our audience says that they know that their workplace has a formal policy on substance use in the workplace. 13% say their workplace does not have one, and 17% say they don't know. So what did we find when we looked at this in our study? So it's very similar. When we asked workers this before legalization, we found about 2/3 reported that they had some sort of policy. And that has since increased, so that now 79% of our sample report that their workplace has a formal policy in place. This isn't surprising, I think, given the push before legalization to ensure that employers develop their policies. So I think it's good. But of course, if we look at the numbers post legalization, we still have about 1/5 that still do not have a policy or aren't sure that they have one. So we have to keep in mind that, 21%, I should say, that don't have that. So we need to keep that in mind, that some of these workplaces still have to really get their policies in place. Among those who reported having a policy, we asked whether that policy explicitly mentioned cannabis. And again, not surprisingly, before legalization, only 32% said yes, that their policy mentions cannabis, and that increased significantly to 73% after legalization. We also asked about drug testing. So few respondents in our sample reported having a drug testing program in their workplace, and there was no change from pre to post legalization. And we wouldn't have expected a change because there has been, to date, no legislative or regulatory change in allowances for workplace drug testing here in Canada as a result of legalization. Again, we've added a couple of new questions to the post-legalization survey. So this first one asked workers whether they had received any sort of education or information from their employer about cannabis use and its effects. And I think overall, as you can see, the majority of respondents to our survey either said that they hadn't received any sort of information or they weren't sure if their employer had provided this information. We also asked whether there was a method or a protocol of some sort in place at the workplace that would explain what a worker should do if they suspect that a coworker is impaired. What we found is that 30% said that they did have a method and that they were comfortable with using it in the event that they had to use it. 9% said that they had one, but they would not feel comfortable using it. While the remainder either said that they didn't have a protocol in place or they didn't know if they had one. So while we have quite a few workplaces now that seem to have their policies in place, there's probably a bit more that can be done in this space. And so finally, we wanted to get a sense from workers what their own personal perceptions were of the risks and permissibility of using cannabis at work were. So we first asked workers, how much do they think that workers risk interference with performance and productivity when using cannabis 2 hours before work, that's on the left-hand side, and while using cannabis while working, including breaks, and that's on the right-hand side. So while the pre to post comparisons were statistically significant, when you look at the actual numbers, the prevalence of this is actually fairly stable over this time period. So workers really weren't thinking any differently about this after legalization than they were before legalization. But one thing to point out here is that consistently what we're seeing is that workers generally feel that use at work is more risky than use in the 2 hours before work. So they think that use 2 hours before work is less risky. That's potentially problematic, especially when we think about edibles and now the introduction of edibles to the market. And again, something that we need to continue to monitor. We also asked workers, how much do workers risk harm when using cannabis 2 hours before a safety-sensitive task? Most agreed it was risky. And again, there was really no substantive change from pre to post legalization. And finally, we asked workers what they thought they would be allowed to do after legalization in terms of workplace use. So on the left-hand side, you will see that we asked about whether they thought after legalization, a worker would be allowed to use cannabis for non-medical purposes at work. And on the right-hand side, whether they would be allowed to use cannabis for medical purposes at work without medical authorization. Surprisingly, at least for me, in both of these instances, we see a slight trend in the proportion of workers who thought both scenarios may now be allowed after legalization. Again, something to continue to monitor. So I know that's a lot of data to sort of take in, so I'm just going to try to summarize and highlight some of the key findings. So first of all, the prevalence of overall cannabis use does appear to have increased, but frequency of use hasn't. And in fact, it looks like more people may just be trying it out. Second, I think it's important to remember, again, that workers are using cannabis for reasons that go beyond recreation. This is a complex drug. It has both non-therapeutic and therapeutic effects. And sleep, pain, and stress were key reasons that workers report using, for which they report using cannabis. Third, there's also been no appreciable change in the proportion of workers using cannabis either before or at work. Of course, these are early days. So these are very early findings after legalization. We know that things can still change. But I do think that finding, I would hope, should be reassuring to those in the occupational health and safety community. Having said that, we still see, a non-trivial proportion of workers who report workplace cannabis use. So it's also important not to become complacent about this. Legalization has opened up the conversation around cannabis use and workplace impairment in general, and we want to make sure going forward that workplaces are still on top of addressing this issue. We also saw that more workers were reporting having a workplace policy on substance use, which I think is great. Policies are the minimum that should be in place. At the same time, few workers reported having been armed with evidence-based information on cannabis from their workplace or knowing what to do in cases where coworkers were impaired. So there's still, I think, some work that can be done going forward in order to address this issue. We saw little change in how workers perceive the risk of workplace use from pre to post legalization. In terms of the findings around workplace norms, it's really unclear how to interpret the findings. The data suggest it might be more normalized, but at the same time, this could simply be an artifact of workers being more aware of the issue and more confident in how they respond to these questions. So again, it will be important to see how responses on upcoming surveys, what we see there. And finally, there were some surprising findings in that more workers appear to believe cannabis use may now be allowed in the workplace. Again, it's hard to know how to interpret this, whether this is a true increase or not. But certainly it speaks to the need, I think, for education. And so when we think about the implications of these findings, I want to start off with that education piece. The results do appear to show some knowledge gaps among workers. And so with cannabis being a legal substance now, education, I think, is the best tool in our toolbox to ensure that workers who are using cannabis are doing so in ways that do not adversely affect occupational health and safety. And I think it's really about some of the basics, the Cannabis 101 concepts, understanding what THC is, what CBD is, what the effects are if you smoke it versus ingest it, how long those effects last, what happens if you combine it with other substances, and also the potential effects, including some of those impairing effects that can have implications for safety and productivity in the workplace. I think workers also could benefit from education on what is allowed and not allowed in terms of workplace use, particularly around medical cannabis. We saw a little bit more there, which could be a particular blind spot for workers. And also have an understanding about wait times. So I acknowledge that there isn't a consensus on a safe waiting period for going to work and engaging in safety-sensitive work tasks after consuming cannabis. There are a number of different guidelines out there. I know that the Occupational and Environmental Medicine Association of Canada has suggested waiting at least 24 hours after consuming cannabis before engaging in safety-sensitive work. I think in general, workers just really need to be able to understand the benefits of a longer wait time before going to work after they've used cannabis, and also understand some of that inherent variability around that wait period, and that we don't really know what that safe waiting period is, but the longer they wait, certainly the better. I think these results also demonstrate the need for employers and workplaces to continue to assess and evaluate their readiness to prevent and mitigate any problems that may occur as a result of legalization. So thinking about, what do you have in place to help address impairment? Do you have a policy? Have you communicated it to your workers? Have you given them any other information or training on this issue? Do you have a procedure in place to accommodate medical cannabis use? Increasingly Canadians are using cannabis for therapeutic reasons, so that increases the likelihood that at some point employers will have to consider how to accommodate a worker who has a medically valid reason for using cannabis. And finally, is cannabis use normalized in your workplace? Do supervisors turn a blind eye to use? Again, norms can influence behaviors, so employers, will want to get a handle on that if that's a problem. So in terms of next steps, again, as I mentioned, our next survey is scheduled, hopefully, to go out this summer. And so that will be the first survey after the introduction of edibles and concentrates to the market. And then we will have a final survey in the summer of 2021. So I just want to say thank you for all who attended, again, given all of the circumstances that we're enduring right now. And I'm happy to take any questions you may have. Thank you.
Thank you, Nancy, for these extremely interesting findings and results. If you don't mind, we will move on to the Q&A session. To our attendees, if you have any questions, please input them in the question box. And our first question is, can you precise who do you mean when you say workers, and why were you interested in studying this category of employees?
Okay, so we were actually looking at a variety of workers from a variety of occupations and industries. So unfortunately, we were trying to get a handle on overall use across industries and occupations. We do know that we weren't able to really look at it too specifically among specific workers. So the results that I presented today are generally across all different types of occupations and industries. And, we would love to be able to do some industry-specific research on this, because I think some industries are particularly interested in knowing exactly what's happening in their workplaces. But at this point, this survey, the results are across occupations and industries. Hopefully that answers the question.
Yes, thank you so much. Next question is, do you think that legalization is the factor that explains the increased trend in cannabis use?
So we can't say for sure, certainly, and one of the limitations of this study is that we don't have a control group, because all provinces in Canada have, every province in Canada and every territory has legalized cannabis. So we don't have a proper control group. Having that proper control group would allow us to infer a little bit better whether legalization may have been sort of the cause of some of these changes. So right now, we can sort of infer it to a degree, but we can't say with any degree of certainty that this is the only reason that caused or that led to that increased trend in cannabis use.
Thank you, Nancy. And have you looked into the effects of cannabis use on workers' health?
So there is a body of literature on cannabis use among workers. Usually the outcomes are around things like accidents, sort of injuries, productivity, employment in general. In terms of looking specifically at health outcomes among workers and the effects of cannabis on health outcomes, we have not done that, and there really isn't, as far as I'm aware, any literature on that. But again, I think moving forward, that would be really important, especially because we can see that workers are using cannabis also for a variety of therapeutic reasons. And so it would be really interesting to see how well it's working, for them, especially for things like work-related injuries. We saw 16% of our sample reported using cannabis for work-related injury or illness. So short answer, no, we haven't looked at that, but I think it will be important to look at moving forward.
Makes sense. And the next question is, some workers might have limited knowledge about the effects of cannabis use. Do you think it is important for employers to transmit that knowledge, and why?
I do think it is important to do so. I think some employers will certainly be hesitant to do so um, out of concern that they may be encouraging use. But again, I think we need to think about the fact that I think workplaces are a really unique point of intervention when it comes to substance use because we are at our workplaces for a large proportion of our day, 5 days a week. Um, Having that information, arming them with really evidence-based information just on the basics of a legal substance. I think, again, we have to keep in mind this is a legal substance. So just having that evidence-based information so that workers understand things around, how long do the effects last, especially, if I smoke it, if I vape it, if I ingest it. I don't understand what the difference is between THC and CBD. Giving them that information, I don't think will encourage them to necessarily use it. And it's certainly, I don't see that encouraging them to use it at work, but it does give them that the information that they need to make sure that they understand what the potential effects could be so that they use it in a responsible manner and in a way that's as low risk as possible, I think, to themselves and to the workplace.
Thank you so much, Nancy. And how would you advise in transmitting this knowledge, and what resources can be trusted?
Yeah, so I think one of the blind spots we have is where we don't necessarily have any sort of workplace specific or not a lot of workplace specific resources. I know some, I think here in Ontario, the Ministry of Labour is developing some information around that. Other resources could be some of, the Canadian Centre on Substance Use and Addiction, who did a webinar actually just a few weeks ago. They are a wonderful source of information. They have great infographics. Even if you post some of these infographics in a common space in your workplace, these are just they are a very trusted source. The Canadian Public Health Association of Canada also has a Cannabis information website that would be really great to use. Health Canada has compiled a bunch of different resources. I would stick to some of those. And again, some of, sort of the government has put out a number of different resources. I think we need to do a bit more in the occupational health and safety space around that. Canadian Centre, sorry, another one, Canadian Centre, oh gosh, CCOHS, I always forget. But they are also, Canadian Centre on Occupational Health and Safety, they are also a good resource. I think going forward, we probably need to do a bit more that could be used by employers, but there are certainly resources out there that could be used. Easy things, just putting them in common spaces even, just so that employees can easily see them.
Thank you so much, Nancy. And our next question is, on the term cannabis use, was there care to solidify that definition regarding THC and CBD products as cannabinoids? Our attendee says that in his or her work, they cross paths with individuals that do not define CBD as cannabis. They say it doesn't count as a drug because it's non-psychoactive. So does your definition of cannabis use include all forms, so THC and CBD, and were your survey participants aware of that?
Yeah, so that's a really good question. I am blanking exactly on how we defined it. We did define what we meant by cannabis. We did exclude prescription cannabinoids in terms of synthetic prescription cannabinoids. And that was part of our definition. I do appreciate that there could have been some, I didn't present it here, but I do appreciate that there could have been some underestimation around CBD exclusive use. But we do have a small proportion of our sample who do report using CBD oils. So it's certainly something to keep in mind as we move forward, I think, with our survey in terms of revisiting the definition and making sure that it's clear about what we're talking about. And certainly if if you want to reach out to me, please let me know, and then I can share with you. I don't have the survey in front of me, I apologize, but I could certainly share with you what the definition was.
Perfect. Thank you so much, Nancy. And we can, if you share the definition with us, I can upload it on our website as well.
Okay, sounds good.
Next question. So do you have any idea about what kind of policies were developed in regards to substance use in the workplace?
No, unfortunately, we only asked that question about whether they have some sort of policy, and when they said yes, does that policy explicitly mention cannabis? We didn't ask about any of the sort of, whether it's a zero tolerance policy. That again, that might be something interesting to add to the next survey. We're always trying to think about how we can improve our survey as we move forward. But we didn't ask that in this particular, the two first surveys at least.
Perfect, thank you. So in your opinion, what are the steps to take to understand or get a sense of the tendencies of cannabis use in the workplace in order to create adequate policies and practices?
Well, if you're speaking about your own particular workplace, I mean, really the only way to understand it is to sort of have an anonymous survey, I think, of your workforce to really know what's happening, I think, in your workplace and how workers are thinking about cannabis use. Even if you don't ask about their use of cannabis, that might be a bit sensitive, but even asking about how they think about it in terms of perceptions of risk, whether they think their coworkers might be using it, but keep it anonymous, that could be a way. And then in terms of creating adequate policies and practices, I know that this is a really difficult, we always say you have to have a policy and do more, but we don't really give you guidance on how to do that. But I will say, if people aren't aware, the Canadian Standards Association is right now developing a standard it's a standard that's specific to managing substance-related impairment in the workplace. And that's going to provide, I think, a lot of great guidance to employers around what exactly a policy should look like, what are the components of that policy, and what are the sorts of supports and things that, could be included or should be included. So there, in terms of the timeline, I think it's scheduled to come out, I think, next year, if I recall correctly. So it is a bit of a wait period, but I think just sort of hang tight. There is something being developed right now, and I think it's going to be a really great resource for employers moving forward.
Thank you so much, Nancy, for sharing this knowledge. And our last question is, if you had one message for our attendees today, what would it be?
I always say this, but education, educate, do what you can, not to be complacent, not to stick your head in the sand about this. It's a legal substance. It's going to be, workers are going to be using it. Let's just make sure that workers understand how to use it in the best way possible that doesn't adversely affect occupational health and safety.
Perfect. Thank you very, very much, Nancy, for teaching us about the impact of cannabis legalization on the workplace, as well as the knowledge gaps related to it, and also for shedding some light on the complex nature of cannabis use among workers. Excellent information. Thank you very much.
Great, thank you.
We would also like to thank our audience for your participation, especially in these difficult times. I hope everybody is staying safe. Immediately following the webinar, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars, as well as suggestions for future topic areas. If you would like to get a certificate of attendance for this session, please email your request to projectadmin@www.dpi.org. If you're a member of WWDPI, you will receive a free certificate certificates. If you're not a member of WWDPI, then there is a $15 administration fee. All of our webinars are created for public access and supported by voluntary donations and memberships. Thank you again for your participation, and thank you so much, Dr. Nancy Carnide.
Thank you.